Another 1 or 2 minutes, 1 or 2 seconds, 10 seconds maybe.
Sir, we are live now.
Hello, everybody. This is another evening. Welcome all. Welcome our panelists. We have a very different forum today, the one that you're going to really enjoy. In last 104 days, the Integrative Medicine Case Reports has been bringing you people from Ayurveda, yoga, the physicians, and almost all spheres of life to understand the role of different systems in bringing or improving the healthcare. And we had been missing the nursing practice for such a long time, who play such an important role in healthcare. So we are today joined by one of our distinguished guests, Dr. Harpreet joins us from Johns Hopkins University in the US, focus on integrative, and she also to Minnesota. She's both a clinician and a healthcare administrator who brings 3 decades of experience in various clinical areas. She helped with the launch of Johns Hopkins Sibley Integrative Medicine, both as program director and nurse practitioner. She currently co-leads this program by directing and managing day-to-day operations of this integrative medicine program and provides the integrative medicine consultations. She has a deep interest and is well informed in modalities like aromatherapy, guided imagery, including various Eastern modalities such as Ayurveda, mindfulness, meditation, and yoga that are enhanced by her roots in India. So she's moved from India to US and where she's been working. She deeply believes in one's inner capacity to heal. She's currently enrolled in the second year or the 2-year meditation teacher training with Drs. Tara Brach and Jack Cornfield. Her interests include mindful eating, self-compassion, healthy cooking, mindful pausing, health coaching, that brings together various aspects of integrative health. She enjoys uplifting and nurturing her colleagues using mindful pause, appreciation, self-compassion. And she also is involved in Qigong and its related practices. And this gives her the practice of gratitude. She loves to walk in the nature with her family and friends and engage in music and poetry. That's quite an encompassing, a very beautiful personality with us. And we hope to learn and to understand what her views are on nursing practices in US where she works and what are the challenges and opportunities. We have a panel also with us. We have Sister Kulbir from a senior nursing officer at PGI Chandigarh, as well as Sister Harinder, who is a batchmate also at PGI, as works at mostly infection control. And we will come to them in more detail, and they will also like to interact with Harpreet and ask questions. And together we'll learn how is it going in the US and elsewhere in the world. So Harpreet, welcome, and please share your experience. How is it at Johns Hopkins and how is life there? Welcome.
Yes, thank you. Thank you so much. It's really my pleasure and a privilege to be on the stage with my esteemed colleagues and Dr. Akshay Anand. And so I actually was only 8 years old when I told my parents I wanted to be a nurse. And I live in, Delhi, and my parents were like, "You're sure you don't want to be a doctor or engineer or a lawyer?" And I was like, "No, I want to be a nurse." And they were like, "Okay." And so I was enrolled at RAK College of Nursing. That's where in Delhi, 4-year program, and then moved to the US in 1991. It was very, deep desire of mine to be a lifelong learner. So I went for a program called Family Nurse Practitioner. And in that, several states in America, so all the 50 states have independent practice. And so in Virginia, it's a collaborative practice with a physician, but other states in Maryland and District of Columbia, you can practice independently with the master's degree. And so with my interest and really realizing in my 40s, having done liver disease, nurse practitioner, manage patients with liver disease and also in bariatrics weight loss surgery, I realized that I needed to come back to my authentic roots. And, with the Ayurveda and with yoga and connecting with the ancient wisdom. And so I started really asking questions and figuring out like, what do I need to do here? So I joined a doctor in nursing practice program at University of Minnesota in Minnesota. And it's a nursing program where not only did I learn other modalities, but also systems thinking. Like, how do you bring change in an organization? Each one of us have these ideas of what we want to do. Kudos to Dr. Anand for bringing systems change in this way of how we're bringing the world together and our practices together. And so learning systems change at Johns Hopkins, I was tasked to open integrative medicine department in 2018. So I was still working in bariatrics weight loss surgery department and, continue to create a program which is multidisciplinary. So we have yoga therapist, acupuncturist, massage therapist, and medical director, integrative nutritionist, and myself. And so it was like, how do we all come together? And what has been so beautiful is that when I see a patient independently for integrative medicine consult, maybe they have a history of, cancer and they're going through chemotherapy and they have some symptoms, side effects. So they'll come to me and then I sit down with them for 60 minutes, one-on-one, really understand who is this person. And they felt heard and listened to, and I can see the healing starts to happen right then while we connect in a human deeper way. And then I could, refer them to acupuncturists. They will go see the yoga therapist. And it is just so interesting to see how their side effects are so mitigated because of all these modalities that are in place. So in my role as a leader and as a nurse practitioner, it's really important. Nurses, as you know, are the coordinators, like you are the glue of the team because we have the expertise of human connection and, we're able to establish those relationships. It's so much easier for us to connect and know, oh, this is the needs of the patient. Oh, by the way, this is what's happening in their family life. Even though someone came in with a diagnosis of cancer and I asked them, what is their worry? I might think their goal is to manage their symptoms and heal the cancer, only to find out they're worried about their dog who has not, been taken care of, who has not gone for walks. And it'll bring them immense happiness if someone can actually walk their dog. So it's so interesting when we start to listen to our patients and not assume what's happening. So much comes out, so much, and also allowing them to see the self-efficacy. When we start to believe in them and we look at them and we say, what do you think about this? What is happening? And with their intuition and wisdom, they are able to say so much. And that leads to healing. Whether cure is possible or not, healing is. So it's really beautiful to see that in my daily work.
Great, thank you for putting that in the context. And it is reminded to once when a patient is admitted, most of the time the sisters, the nurses, they take care of the patient and they're the ones who pretty much change the environment around the patients. And if it is more compassionate, if it is more engaging, the patient is half healed right there, even before the physician walks in and takes a look at the charts and starts prescribing. So,
sorry, one more thing. And as you know, and thank you for noticing this, this is the year of the nurse and midwife. WHO has recognized this. So it's wonderful that we are having this discussion while we're right in the middle of the year of the nurse.
Thank you for reminding that. Yes, and today we have two more nursing officers along with you from our own institute, PGI Chandigarh. We are joined by Sister Harinder, who is a BSc in nursing and a senior nursing officer. Both of them have kindly consented to be with us and share their ideas and interact with you. And in the process, the audience and all the healthcare workers out there will learn from our interaction how the life is in the ward and what the challenges and opportunities are. So Sister Harinder has worked in the infection control unit. She's a senior nursing officer. So, Sister Nurse, Sister Harinder, would you like to uh, ask a question that comes the top of your head, listening to her, and you need to unmute your mic. Once you do that, you can ask a question. Yeah, you're ready to go.
How do you compare your feelings nursing a COVID patient versus when you nurse a cancer patient?
So how do I compare my
She wants to
feelings?
know. Yeah, it's a very good question. You know,
Yes,
she's asking
yes.
when the nurses are confronted with all kinds of patients, from those suffering from infections in communicable wards, you know, the CD wards, from to the labor rooms and the cancer patients. And now we have COVID as a COVID crisis, as a pandemic.
Yes.
So she wants to
Yes.
know, how does it feel as a nurse practitioner or as a manager when you treat cancer patients versus when
Yes.
you treat the COVID patients?
So I wanted to give a context. Thank you so much for asking that. The context is that, you know, during the COVID pandemic, around March, we shut down a lot of our units and departments temporarily because we wanted to focus on COVID. And so we had a lot of displaced employees who had nowhere to go. And we recruited, put together a team. So myself and another nurse who is the manager of primary care practice, we both banded together, assembled a team of employees from gastroenterology lab to OR. And so we were tasked to create a COVID testing tent. It's a drive-through tent. It's right outside our emergency room. And we put a tent so people drive through, come around, and we go ahead and test them. We do a nasal swab and then they go off. And so when I was asked to do this for the first time, you know, I had my fears. So it was very interesting to notice, and using my mindfulness, you know, of being present, I noticed how scary that was for me. You know, the initial thought like, oh my God, I've been tasked to do this. I'm going to be so close to someone, you know, that has been so threatening, and, you know, so many lives have been lost. So it was the reaction of that, of fear, uncertainty, concern, worry. And when we all came together and we assembled the team, it was very important for me to, during training, you know, to engage also our team members with, you know, with knowing that this fear is normal. So I asked them to share what their thoughts were, and people said, and then another member said, well, you know what, the beautiful part is we are the ones with full PPE. We're the ones fully protected. My risk of being outside, you know, elsewhere is much bigger to catch the infection than actually be in the tent and have full PPE and be testing, you know, and we've taken care of patients with HIV, with hepatitis B and C. You know, yes, it's a little bit different, this one, because we weren't quite sure of its characteristics and how it's behaving. And yet, you know, it brought us a lot of reassurance that we have the PPE. You know, the concern was also not having enough, right? So with cancer patients, you know, you're there to help them, you know, and be present with them. With COVID, you want to be in and out. You want to finish the work and you want to get out, right? We want to minimize the time spent with them. So there is this nuance with making them feel that we care and there's a human connection. And yet we have to shorten our presence, you know, our time together. So it is quite a challenge. I wouldn't deny that.
So how would one compensate for that? Having digital access, maybe keep video calling them as a nurse?
Absolutely. Absolutely. So it's been wonderful for us. Well, we've done exactly that. Actually, we have, you know, we have plexi, you know, glass barriers. We have iPads, but we've given to our patients. So they're in the room. If they're inpatients, they're in a room and they have their iPads. So they can actually, if they're awake and alert, not in ICU, of course, they can actually, you know, check in with the nurses, let them know what's happening. Nurses can dial in and, you know, do some assessments, you know, so it's been really helpful, the technology. I am very curious to hear your experiences, sisters. So I would now pose back that question to you.
So
How's that?
Sister Harinder, how has been your experience? She wants to know, have you been posted to COVID yet?
No, not yet.
Okay. As for cancer?
Not For cancer, I have worked as an infection control nurse, and I worked in CCU before that, and I have not posted in COVID unit yet, so I cannot answer this question.
And
But
how
being
about
an
the
infection
cancer? Yeah.
But being an infection control, I visited NHE many times. I have participated in many things for preparation of that, for starting NHE. I have participated in that part, but
In
I
the
have not
orientation,
done.
in the orientation of doffing and donning?
Yes,
I mean, okay,
we prepared that along with the Dr. Guru.
great. So
And
we have,
we also do the training part also for the healthcare workers for our PJ.
so you're basically mentoring other people who are going to be going to NHE or the COVID block. And so that's even more critical because you need to orient them perfectly so they do their job well and they adhere to the guidelines that you put out to
We
them.
try our best for
Sure,
this.
sure. We're also joined, Harpreet, by Kulbir, Sister Kulbir, and she's also a BSc nursing, but she's also a PhD in developmental psychology. Both of them have been very kind to join us at a very short notice. You know, we have this program running almost every day, so we scout for panel, we scout for speakers, and it's so joyful, and people just fall in spontaneously. So both the ladies, are proud of them. They are doing so good for our institute. So Kulbir is one of them. She's a PhD in developmental psychology. And over to you, Kulbir. You want to anything that
Yeah,
hits your head? You want to ask something or comment on what Harinder said about orientation? Up to you.
regarding PGI, actually started PGI
I think we have
and
a
do
same
check in.
problem of the bandwidth. So if you have, if I may, yeah, if you,
I will switch
this
on
is better.
my video.
Yeah, please go ahead, Harinder.
Is it okay now?
Yeah, this is good. Please go ahead. We
Okay.
can all hear you.
So we had PDCA. We are actually following PDCA approach here: plan, do, check, and act approach. So in planning phase, we made protocols basically. So we were following all the CDC, WHO protocols with a bit of our local challenges, which we incorporated those changes in the protocols, and then we started making those protocols. And then in the do act, we started training, which is still going on donning, doffing, disinfection protocols, and apart from that, other infection control practices that we are teaching all the healthcare workers who are going to post there. Then in check phase, we actually take feedbacks from healthcare workers, and then we have some WhatsApp groups also where they give their day-to-day challenges, and we tackle those side by side. Apart from that, we have CCTV coverage in the area, and in the control room, we actually guide them. It's a one-way communication, of course, but we guide them during doffing because it's in doffing area also. And we also am I audible?
Yes, yes, please go ahead.
Okay. So we actually, apart from the doffing area, we have some CCTV in the corridors and in the units itself. So consultation, if any needed, it is given downstairs only. So we, most of the consultants, they can actually give their consultants while being in the green zone. And if needed, they go to the red zone also. So this is
Great,
how we are doing in
great.
PGI.
Very
Yeah.
nice. Do you want to ask something to Harpreet?
Yes, of course. Harpreet. Okay, Harpreet. Do you want to ask anything?
No, you can ask Harpreet.
Yeah, I
Yeah.
have actually one question for Madam.
Sure.
What is the most important challenge confronted by you, ma'am, during this COVID outbreak and the COVID epidemic? And how is it different from that of a physician? As a nurse, the challenge, how it is different from that of the physician?
So do the responses of
Yeah, so sorry. I'm so sorry. 1 second. Sorry, we have some work happening, so it's too loud. My apologies. Sorry. So I think, as I mentioned, you know, as a nurse, the connection that we have with our patient is not just of like, okay, I'm here to do this work, and then I'm out. I think nursing sees the mind, body, spiritual, part of the person. We see the person as a whole. So it's really important to a nurse that, the patient is feeling heard, listened to. As a physician, and even as a nurse practitioner, when I would do my rounds in the hospital, it was easier to just say, okay, this is the plan today. And then, okay, this is a medication adjustment I'm making. And then, you can leave the room. But as a nurse, I think it's so important for us to make sure that we are touching base with the patient, connecting with them, seeing what's on their mind, that we cannot just turn off, like, okay, my job is done, I need to go now, versus we're connecting with people as human beings. So I think that's the difference between a nurse and a physician. And don't get me wrong. I mean, there are amazing colleagues I have as physicians who really care and may also feel the need to really pay attention to the patient.
And in terms of, I think Kulbir wanted to know if the responses are also different. Did we lose her? She was walking around with some background noise. Harpreet, we can't see you. So we apologize to the viewers. She'll be back. We had some problem of internet with our panelists. So panelists we cannot see, but Harpreet
Yes,
went
sorry about
out
that.
in a
Yes,
moment.
sorry
Now
about that.
she's back. No problem.
Yeah, actually you were saying, sorry.
I was saying, I was trying to take the question of Sister Kulbir further. She
Yes.
mentioned, do the physicians respond in a different way than the nurses do when there is an epidemic like COVID? So you explained the functions of the two in brief. The mind-body connection is more involving for a nurse, and she remains most of the time. So all those things, the connectivity with the patient. But in terms of the response to the epidemic or the fear and uncertainty of COVID, is it different from the fear that a physician has, or is it the same, or it shouldn't be compared? Any comment?
I think it's really important to actually explore it, but I just don't know, since there is not a physician in the room that we can ask. We know by just the way of our, sorry, I'm just going to move out of the sound.
Please.
It was nice and
Sure,
quiet earlier,
sure.
but now.
I'll try to connect to, yeah, you find yourself a position, no problem. I know you had an emergency outside.
Yes.
Sister Harinder, yeah, any of our panelists want to come in and
Yeah, actually,
comment or add something, ask?
yeah, actually, because I personally feel that psychology goes side by side in nursing, no? So I was more keen to ask Harpreet madam about some issues related to a learning system change, which she mentioned earlier. So maybe after some time we can ask those questions.
Yeah, she's stable now. It seems she
yeah,
has found a
it seems
good
like that.
position for herself. Am I right, Harpreet?
Yes, I'm good right now. So
Yeah,
you were
okay.
saying, yes, could you please repeat your
Yeah, I
questions?
think our question comes mainly because she has a PhD in developmental psychology. She was
So
asking
I
something
was
about-
wondering, like in PGI also, I feel the same thing. Like behavior change is the most important challenge, which I feel as an infection control nurse as well as a senior nursing officer. So you mentioned somewhere in the beginning that learning system changed, and you are adopting those changes in the learning system. So what are those things?
Yes. So, in the beginning, we were talking about donning and doffing training. This was really concerning. It was leading to a lot of fear. At the same time, some of the physicians got a little upset because the nursing, education was actually responsible for doffing and donning training. And they felt like their egos were hurt by someone telling them that they were not doing it correctly. So that was interesting to see. It wasn't about like, oh, you're keeping me safe and you're making sure that our patients are safe. It got turned into, how can you tell a physician, what to do? So we had to engage with then our chief medical officer and make sure that, if there was this collegiality and there was the common goal was to keep patients and ourselves safe. And so people were then more understanding, but it was interesting to notice that. So yeah, did I answer your question?
Yeah, most of it is answered, which I personally feel that most of the, if we go through the graph, the middle part is easier to change. The hierarchy, as the hierarchy goes up and as the hierarchy goes down, or it's a bit difficult for us to help them understanding things. It is possible, but it takes time. Yeah, it happens, but that is the main challenging part somewhere. And
that is very interesting. Thank you for your lens of how you see things and your knowledge from your doctorate. So that's really very
that's
nice.
I think most of it comes from the experience only, which I found during my years of experience.
PGI Harpreet is a large institute, a huge number of patients and a lot of physicians and nurses and technologists. And that also exposes her and us to a variety of situations and a lot of socioeconomic differences in patients, as well as physicians and the healthcare force coming pretty much from everywhere in the country. And it's one of the premier institutes. They have strong academic programs. And I think so she's quite good, quite correct in speaking about the changes as they differ over the hierarchy. But anyway, I would like to ask, is there any innovation you can think of in terms of healthcare delivery, especially in the COVID times, on new means of management, or as she mentioned, the learning system? Do you think the new nursing cadre or the new girls who are into nursing course, should they be oriented in some different fashion now that this pandemic has come to stay?
So, first of all, really realizing that multidisciplinary team approach is the best way. We were very creative in pulling those staff members from operating room. These were, technicians to, some of the other assistants in OR who learned how to do the nasal swab and how to collect specimen, how to use EMR, to see patients. I mean, last Saturday while I was at the tent, or 2 Saturdays ago, we saw 130 patients in 6 hours. So it's a really quick process. 5-minute appointments. People come in, they line up in their cars, and they just keep coming around, and we just go ahead and swab. And so I think first to know that flexibility is really important. Second, to recognize what is happening in our emotions, because once we recognize and bring out what's happening, it's so much easier to manage it. If it's not unheard, if there is no safe space to share what's happening and what we're thinking, it's really hard to give ourselves, give our best to others. So if I was fearful or worried and anxious and nobody really talked about it, it will be very hard for me to be 100% present at work. Because we were honoring our emotions and thoughts, and we brought the elephant, they call it bring the elephant in the room, calling the elephant out in the room. It was easier for us to say, okay, this is normal. We're all feeling like a human being, worried about our parents, worried about our children, our spouses. What if I bring this home, and so forth, and worried for myself, worried for my community. So, okay, what do I need to do? I need to be the best DOFR donor. I need to use best IP practices. And so that is really important. First, be human enough to explore and share your experience and share your thoughts. Second, be the good, understand your practices, infection prevention practices, and really hold on to those. The nursing, I would say, for future, people should know that flexibility is really important. Always speak your mind. No idea is too small to be entertained. I think it's always important, as a beginner, as a nursing student, or a professional who's been in nursing for a long time, really important to share the idea instead of saying, oh no, I don't think it's going to work, and we'd never say So that's how innovation can happen, is when we entertain those ideas. We know with design thinking, we have to come up with hundreds of ideas, and then maybe there are two plausible, things that we can do eventually. So ideas are really important to be honored. So I also wanted to say in the United States, there's a huge push for men to be in nursing as well. I mean, there are amazing male nurses who are doing such a great job, and we need more males into the field. So that's another encouragement I would say is, to those who are considering, a satisfying profession, nursing is something equal for men and women. So I really put it out there for men as well.
Very good message. Very nice.
Yes,
Sister Harinder, you want to ask or comment on that that Harpreet just mentioned about males getting into the system, and anything else? Sister Harinder? You have to actually, if you're trying to speak, you have to unmute. Yeah, this is good. Yes, now you can speak. You can even come, you can come live. You can put on a video.
Okay. Ma'am, what was the biggest fear being a COVID warrior for you?
As I was mentioning, yeah, the biggest fear was multiple, right? One was, oh my God, how is this going to affect me? Because I'm right there, face to face. They're in the car. We're doing COVID testing. People are in their cars, and I'm getting a nasal swab from them, right? They don't have a mask on right now. So the fear was, what if I catch the infection, right? That's my biggest fear. What if I bring it home? What if my aging parents, my aging in-laws are all, 7 miles away from us? So we've been seeing them behind a mask, like, and I do video calls. So those were really the worries and fears that I had in the beginning. But as the time now we're into, sorry, go ahead, please.
How you
I'm sorry.
overcome all those fears?
Yeah, so I think as I was sharing, just really being human. It was very important for me to be authentic. I felt safe space where I was able to share with my team, like, what, this is really my concern. This is my fear. Is anybody else feeling this way? And then people all came out and said, you know what, I'm feeling this way too. And so then we said, okay, so what do we need to do about this? Well, what we need to do about this is good IP practices, good donning, doffing, and keeping everybody safe, really being very clear about what's dirty, what's clean, sides of the tent. So we've been very conscientious about that. So I think that has given us a lot of reassurance. In fact, it's so interesting. When we don't have patients coming in, just within 2 or 3 minutes, I just do a Qigong practice with them. So I will, we all just go in with our gowns, and by maintaining social distance, we just do a breathing exercise. We just do a gratitude practice. So even amidst the very busyness, I think it's really important for us to make sure that we are, it's really important to make sure that we are remembering and sprinkling self-care throughout the day. I think that's really important.
Excellent. She will be, by the way, for the information of the viewers and the panel, Harpreet will be with us 2 more days. She will be taking those sessions that she just mentioned about self-care and mindfulness and how she handles herself and sort of an inward help as she offers herself. And as a COVID warrior, as a nurse practitioner. But I can't stop asking you, Harpreet, are there any research projects being taken up by the nursing practitioners as well in your center? Do the nurses take part in research when you do these experimental self-care, when you implement them or operationalize them?
Yes. So my research, actually my QI project for doctor and nursing practice was on use of essential oils. And so the process of application, applying that into Johns Hopkins IRB is quite the same, whether it's research or a QI project. We're actually in the midst of also a research project on nutrition education for staff, for hospital employees. We know that hospital healthcare workers actually are have poor health as compared to the regular public for some reason. It's so interesting to see people eating fried foods and things like that. So we are, it's a 12-week study. It's actually going on right now. Now it's virtual. So for 12 weeks, every Friday for an hour, our research subjects who are hospital healthcare workers get nutrition education. They've already had their assessments, their blood assessments, and their questionnaires. And then we'll check that again at 12 weeks conclusion of their education and see how that's changed their belief system in food and how that's, so we're really going plant-based mainly, and we're encouraging them to do plant-based and see if they had diabetes, cardiometabolic conditions, has that changed any of the markers change at end of 12 weeks. So nursing, one of the principal investigators, one of the 3 principal investigators at our hospital. So it's really important for nursing because, as nurses, we ask the question, we wonder, why are we doing this again and again over years? Why don't we change something? So when we ask the question, it's easy then to answer. Let's, explore this through research. And we have, great practitioners within IRB, nursing, professionals in IRB who are also looking at those in addition to physicians and other scientists.
By IRB, you mean the Institute Regulatory Committees, the ethical committees, right?
Yes, for review board, institutional
Right,
review board.
Right.
Correct. Yes, thank you.
Do you want to comment on that, Kulbir or Harinder, about the research? The food
Research actually is really very important these days. I think evidence-based practice is always a good thing, and we should encourage our nursing officers to do some kind of research in their own areas. And being an infection control nursing officer, wherever I go, I encourage my nursing officers, and we actually are involving them in more and more projects along with their consultants and
also she's focusing, Kulbir, on the nutritional aspect of more of the areas of investigation that pertain to the healthcare worker themselves.
Nutritional aspects, as far as I know, healthcare workers, if I know the data only for the nursing officers. Once I read somewhere that in PGI only, so vitamin D is the most important thing, which is less, which is found less in nursing officers in PGI. So yeah, the nutritional aspects are important.
Educating the nurses, the physicians who are the healthcare workers and the other team members about the need for their good health, their nutrition, and of course, as she mentioned, the mindfulness, the spiritual health, will together make them more powerful, more compassionate.
Yeah, integrative approach is very important, because we should take not only patient but healthcare workers as a whole, because it's not only a nurse comes to the PGI, it's a mother, it's a daughter, so many relations that comes together to PGI, and then a nurse is supposed to leave all those relations at the locker room only, where they do the change the scrubs, and then they enter the ICU or unit as a nurse only. But as soon as their duty finishes, all those troubles, everything which they have taken from their home, that comes again in their mind, which actually affect their work, and which affect their health as well. So it is very important that we should take integrative approach to take care of all the healthcare workers as well.
Absolutely. Kalyan wants to ask something. You came up, and I'm sorry I couldn't invite you to ask a question. Do you want to ask, or you were just trying to tell us that time is running out?
No, sir. Actually, I wanted to ask to incorporate this integrative approach like yoga and all, Ayurveda also, to take care of health in nurse and doctors also. So that was my question.
Absolutely. Do we have another one? We can maybe take one question, either of our 2 distinguished nursing officers.
Harinder?
Yeah, we can hear you.
So maybe Harinder wants to ask something.
Harinder, do you want to ask anything? While I apologize to the viewers that our nursing officers have some internet issues, so they can't come up and show themselves up. They were there briefly. So in order to, we can see her. Thank you for coming. We wanted to make sure that the conversation is seamless. and the question and answers are there, and we can, learn something from the experience of Harpreet, who's at Johns Hopkins. She's, by the way, also our editorial board member of the journal, which is doing this program for last 104 days. She's the editorial board member for Integrative Medicine Case Reports. So yes, Kulbir or Harinder, Harinder, you want to ask something? If the, I think
ma'am, can you give us a message to the healthcare care workers globally? What it would be?
Wow.
Yeah, so, I have to say, like Akshay's mentioned, the most important thing right now is including integrative approaches for our own health. Only then we can take care of the world. So it's really important to keep our self-care first and foremost up front. So this is just a reminder to make sure that we're sleeping well, we're praying, we're eating well, we're resting, and noticing the ruminating thoughts. Like if we have thoughts that are coming that are not serving us, then it's really important to use either breathing technique or meditating or praying to quiet the mind, or movement. This could be yoga. This could be a stretch. It could be just a walk. It could be walking inside the home. If there is, not an available safe space to be outside, then just moving inside, or even just standing as a real human being upright, noticing the feet on the floor, the connection we're making with all the way down to Mother Earth, like the magnetic core of Mother Earth, and just feeling that connection in our body and in our heart area, then sensing the gratitude. So we're feeling supported with the Mother Earth and the sense of gratitude in our heart for anything we're grateful for. Maybe our life, our health, our family, the love, the abundance of being able to have food on our, at our table, 3 times a day. So there's so much to be celebrated and be grateful for. That brings joy to me. I mean, I just feel so grateful amidst this adversity, amidst these difficult times. And then I'm also being very mindful of avoiding too much media. I know this media is really important. At the same time, I think we should really be intentional about how much news we're going to consume. And so it's really important to spend our time like this, learning from each other, having conversations, really, having our minds be more utilized in the right way versus worrying about things or having to listen to the news the 10th time, the same thing. That brings us energy down. So that's my message to everybody. Live to the fullest. It's a gift.
Yeah. Any specific
is the present.
So this is the message also to the young nurses who are being trained at this time as we speak. And if you were made the director of Johns Hopkins, what would you do?
So, I'm really very grateful. I mean, as the director in the integrative health, I've just noticed with the nursing background, of connection, of seeing the human beings and how we're already natural collaborators. It's so much easier. So as a director, the good news is, in fact, Johns Hopkins president is a nurse. Mr. Kevin Sowers is a nurse.
Wow.
He Duke University. He is amazing, and he's a master's prepared. Has been, operational officer and president, vice president of Duke, and now he's at Hopkins. And he's made amazing changes. One of the strategic goals he mentioned he wants to do is to break down the silos, and that's the sign of a nurse. We collaborate, we break down the silos. We need to make sure that we're using the expertise of each one of us. So it's not like, oh, this is mine, this is yours. It's really all of ours. And we contribute to the cause, and then we're able to, reap so much benefit, because when all the brains come together, there's so much, synergy in that, that we can tackle any problems. So I think if I was a director of Johns Hopkins, I would also do the same, really bringing the silos down and letting people see what they bring to the, bringing value. In fact, I was talking to some of our plant operations engineers, plumbers, electricians in our hospital, and we have a very good connection with them with integrative medicine. They come into our space, they read the message of the day, And, these are these big burly guys, these tall, white and black and brown and purple people, these big people, all guys. And they just bow, they meditate with us. It's just amazing to see when we respect and love them in this way. They feel pride in the work they're doing. I mean, they're helping us run the hospital, and especially during COVID. There's so many things they've done. They've installed HEPA filters. They've, put walls, between barriers between different units. And so it was so important for us to recognize their work. No job is small or big. I think we're all equal. And so I don't know about India, but in here, we're really trying to put down the hierarchy. So my department is very flat. Even though I'm the director, we have a medical director, anybody can say, you know what, Harpreet, I don't like this idea. How about this? I was thinking this is our problem. How do we solve it? So I want people to feel empowered in solving problems and coming up with ideas. We use SBAR as our acronym, SBAR as, situation, background, action, and recommendation. So I think we should use SBAR, very smart way of communicating as nurses, as other team members about the problem, what is the solution. So coming in with, that way people know, like, okay, you really paid attention, you thought of a problem, you thought about a solution, you've really also sharing why it's affecting us. And so I think that's also quite important.
Thank you very much for flagging this issue of bringing the plumbers and the engineering people to come and meditate with you. It looks very exciting. I'm already feeling that in our forum, we didn't get our engineers. They walk into our lab, they repair a lot of stuff, and we just look at them as service providers. I'm going to talk to my editorial board and maybe invite the engineering team to another program right here to celebrate with them. And we want to know what you do meditating in those premises where you are. So why don't you tell us what is in plan for next 2 sessions in our program? You're lined up for 2 sessions with us. Why don't you just use this opportunity?
Yes, absolutely. I am so excited, Akshay. Thank you so much for this opportunity. We're going to talk about how to breathe. We're going to use gratitude practice, and we're going to use self-compassion. I think we cannot love anybody if we can't love ourselves. It's really something I found. I'm 52. I'm turning 52 this month. I really found that only through love for ourselves we can love others, and we can give fully to this world and live fully. So I'll talk about self-compassion. I'll talk about gratitude practice. These are all free practices. They're portable. We can carry them wherever we go. It doesn't cost us anything. No special equipment required. So just us and our minds and our hearts. So I look forward to you joining me tomorrow and day after.
Yes. Tomorrow and day after. Please note Harinder Sister Ji, and please circulate the news, circulate it in your groups, and I'll do that in my group.
Sure.
And that'll use. Do you have any last question to ask, or shall we look forward to?
I think Madam has covered all the things mostly. I have just one thing more to ask. If we can go back in time, so, and if we have chance to do it, to COVID management again, maybe. So, do you have any regret that you could do it in a better way? You want to change something the way you have done now? It could be done in a better way.
Sorry, viewers, for the viewers, I will put it again because there was a.
Yeah, let me.
Your voice is actually breaking up. So yeah,
I think it's getting better. It will get better now.
Yeah. So you asked, would you like to, if given a choice, Harpreet, to go back to time, what is it that you would like to correct? That's the question.
Yes, this is the question. Right. Any one thing which you think that you could do, you could have done in a better way.
Over to you, Harpreet. I think she's frozen up. We need higher internet connections and 5Gs to make this session more lively. But I think we had a great time, all of us.
Yeah.
I'd like to thank Sister Kulbir for being there, and Sister Harinder for coming at such a short notice. You've been there in PGF for the last 20 years. Have been contributing in a big way, and salute and thanks to you. I think Harpreet's really frozen down, but she'll be there tomorrow and day after. Please let your colleagues know, so that they can make more benefit out of our session. So with that, we close the session because she's really logged out. Are you back? Oh, we are back. I was almost closing the session. You have to unmute yourself, Harpreet. you have to unmute yourself. Yeah.
So I was just talking about imposter syndrome, and I was saying, you know what? So that's really helped me through mindfulness. I realized that this is just a play of the mind that's saying, oh, you're not good enough. Oh, I don't think you have good ideas. I don't think, somebody's going to find out. So that is something I would change. I have gotten so much better now where I can actually see imposter syndrome coming in, and I laugh now. It's like, oh, there comes imposter syndrome. And so when I call it out, it cannot do anything to me. I still stay strong, and I don't underestimate the power one person has. Each one of us have in the world, in our organizations, in our units. So I think it's really important to believe in the power we each one have. And I might have not said so many ideas I had all these years over the years when I thought, oh, it's not a good idea. I don't think it's going to go. I don't think anybody's going to care for this, or they're going to think I'm so stupid or silly. So if I look back, I would say I wish I had changed that, and I wish I hadn't suffered from imposter syndrome. But now, as the time has gone by, I've really seen over the years, how much each one of us gives, fully to the community, to our hospitals, to our profession, to other professions, and to ourselves. I've realized that, I'm doing a good job. So it's really helped me. Thank you.
Thank you for being so frank, and thank you for asking that question, Sister Kulbir. Thanks, Sister Kulbir. Thank you, Sister Harinder. Thank you, Kalyan. And thanks and good wishes to Johns Hopkins and your people you serve, the patients. And we look forward to a great session tomorrow, 6 p.m. Thank you very much.
I'll see you tomorrow. Thank you so much, sisters. Really important.
Thank you. Bye.
Thank you so
Nice
much.
talking to you.
Bye.
Yeah.
Very nice to
Bye.
meet you. Thank you so much. Thank you, Harinder. So nice to meet you. Thank you. Thanks to the viewers. Thanks. Bye.